My name is Lynette Choge. I am a mentor mother working at Elwesero Health Center in Kakamega County. I am also a community health provider coming from Rosterman Community Unit in Urambi Sub-County.
A mentor mother is an expertise mother who is positively living with HIV, and she's able to talk to the people in the community. Them plus the community health workers, they are our linkage between the health facility or the service provider with the community.
Kakamega County is one of the largest rural counties in Kenya. It has a population of 2.5 million people, over 200 health facilities. Almost 85% of our population gets health services from level 2 and level 3, which is mainly primary health care. Primary health care requires a lot of investments. We have seen the parts take up quite a number of these services, especially in mother and child health, immunizations, malaria prevention, because Kakamega is an area that is endemic in malaria.
Among the tools which were provided and supported by PATH included a tablet. So with that, at the end of the day, you're coming up with a standardized way of seeing children. So there's no discrepancies in the diagnoses, because the app will give you a diagnosis that even if another person sees that child when you're not there, that thing remains standard.
Primary healthcare is the foundation for providing access to care for the world's population. Investment in primary healthcare has all the components that you need to serve the populations in the countries that we work in.
Elwesero is a level 3 facility, the lowest facility in the community. Outpatient services include the clinical assessment, laboratory workups, and management. Most cases coming in through outpatient department. Malaria is one of them, diarrhea, pneumonias, and common cold. People living with HIV, they have their special clinic where they are also being followed up, and in case of anything, they are treated.
Our approach is to ensure that health services are not only effective, but also respective of and responsive to the preferences, needs, and values of individuals and communities, and of course with a very deep focus on integrated service provision. In 2023, PATH supported the national government in training over 200 master trainers who were then deployed to support the rollout of primary care networks across the country. To date, close to 200 primary care networks have been established and are really revolutionizing the organization and delivery of essential services for diverse populations.
Kwa majina ni Caroline Vienda. Naishi Elwesero, Kakamega County. Niko na watoto watatu. Kwanza kuna 12, mwingine 8, mwingine 4, na mwenye nimebeba kuna miezi 3.
Since I started working as a mentor mother, I've managed to enroll over 150 HIV-exposed infants, of whom all of them, except one, were negative. That one was positive.
Lynette alikuwa anatumanisha hata nyumbani. Anatuma mtu ananiambia Karo akuje. Ama ananikola ananiambia Karo kuja. Ananiambia Karo usijali. I'm happy when I see these kids growing up, coming here, their mothers happy, bila hiyo stress ya mambo na HIV.
Huduma ambayo tuko nayo hapa, ndio tumefurahia, ni kuwa na hospitali karibu. Kwa wale watu wenye ambao hawezi fika Kakamega, tena hata wale wa mama wenye ambao ama wazee wenye ambao wana nguvu ya kufika town kule Kakamega, hauwezi kuja hapa ukose dawa. Alafu ukose service. Madaktari wako chonjo. Unapoingia, wanaingia wakijua unataka nini. Ukichelewa kidogo, wanakupigia simu.
Sijaenda hospitali nyingine, ni hapa tu Elwesero. Niliona madaktari wa hapa wamenisaidia sana. Chanjo zangu nikiwa na mimba nilikuwa nakuja hapa Elwesero, napewa naambiwa fuata maagizo fulani. Hata mimi sikuwa natarajia mtoto wangu Nathaniel atakuwa mzima. But ametoka mzima, nilifurahia. Tunafurahia mwenye nimebeba atoke mzima.
PATH has been an important partner for us in the ministry, especially on the level of advocacy, so that people could understand what primary healthcare is and also implement primary healthcare.
In the beginning, PATH was in a fewer facilities, but when it expanded, it's now in many facilities. And we are seeing that those areas of under 5s and pregnant mothers, the number of under 5 children who are dying, of course, of malaria has also reduced. And the number of mothers pregnant who are dying because of malaria have also reduced.
The network approach that's being demonstrated in Kenya is one that I think is really exciting because it's crowding people in, it's crowding leadership in towards the same shared vision and goal of ensuring access to essential health services for all individuals.
The approach is really to try to understand where are we doing well and where are the gaps in a current primary healthcare model, and are we reaching all the people that we want to reach? And if not, what is the plan to address the unmet needs that we don't address today?
Vile hawa wamama wanakuja wakinitafuta, wakihitaji advice, wakiona watoto wao wakigrow up vizuri, they really appreciate. Wananiambia hii ni efforts zako, and I'm very happy that at least what I tell them ina work na at least ina bear fruits.
We really appreciate for the effort that PATH is doing, the drugs, you're getting them on time, and also the timely mentorship programs.
We are very grateful as an organization to our development partners such as the Gates Foundation, USAID, Unitaid, Gavi, Astella's Global Health Foundation, and many others for trusting us, but also working with PATH to bring health within reach for everyone.
We're hoping that now we'll all work together so that we can actually implement the guidelines that have been there for primary health care. It gives now the people essential service that is needed.